I'd be really interested to hear from you around the process of decolonising knowledge. So we've talked, well, our speakers have spoken quite a bit about the difficulties and the challenges around the whole knowledge production process. And so I guess it would be helpful for us to understand, well, what does it mean to decolonise knowledge, and why is it important in the mental health research context?
Hi, Natalie, and thank you very much for inviting me. As everyone else said, these are rather big topics and to discuss in such a short time. But I'll be quick. Decolonization or decolonizing in the university context is now talking about decolonizing the curriculum. And it's often very narrowly interpreted. And so it's about, people think if I add a few Black authors to my list, that's it. And in research, it's if we include a few Black people in our research, then we're okay. And if we have a Black researcher, that's going to be okay. Decolonization and decolonizing knowledge is broader than that. For me, it's breaking down the structures that maintain the status quo. So the structures that support institutionalized racism is what we need to break down. And we can do this by analyzing how oppression and how power is used to exploit, discriminate, oppress racialized groups. So that's the first thing about decolonization. And the second thing about it is one needs to examine and challenge the beliefs you hold about other groups, because decolonization is also to check othering and how that happens and how we can stop the processes of othering, but also how we can value the views of other groups. So that's just in general, and I can talk more about this. But when we come to mental health, it's about challenging and analyzing how Eurocentric ideas are used to inform research. And I think Suman Fernando argues this very clearly, Western models of mental health doesn't always apply to other groups and people from different cultures. So that's quite important. And for me also, and this is alongside other people who argue this, decolonizing mental health research is about disrupting the alignment between ethnicity and mental health. Ethnicity is not a risk factor for mental health. That's a myth, that's wrong. What is a risk factor for mental health is the adversity that comes from ethnicity. So the discrimination, the racialized trauma, the exclusion, the marginalization, those put Black people at risk for mental ill health, not the ethnicity. So we need to really disrupt this alignment between ethnicity and mental health. Dawn talked about the invisibility, and I think what we need to do is make race and racism visible in research. I would also encourage white researchers to explore how white privilege operate to reinforce racialized discrimination. And if we want to decolonize mental health research, we need active involvement of racialized groups in the planning, conducting, and implementing of research. Thank you.